Marfan syndrome is a genetic disorder of the connective tissue. People with Marfan tend to be unusually tall, with long limbs and long, thin fingers. In addition to affecting height and limb proportions, Marfan syndrome can produce other skeletal anomalies. Abnormal curvature of the spine, abnormal indentation or protrusion of the sternum are not uncommon. Other signs include abnormal joint flexibility, unexplained stretch marks, stooped shoulders, and speech disorders. Marfan syndrome affects males and females equally. Estimates indicate that about 1 in 3,000 to 5,000 individuals have Marfan syndrome. We're about to watch somebody with Marfan syndrome enter a normal-sized house. Shh. I think this is one of the Marfans. Hold on. Here's Jimmy the Marfan. Inside real quick. Hold on. Let me get him for you.
I'm sorry, Parker! I thought that was the door! Do you have any sugar for me?
Marfan syndrome is caused by mutations in the FBN1 gene on chromosome 15. This encodes the glycoprotein fibrillin-1, a component of the extracellular matrix. Fibrillin-1 protein is essential for the proper formation of the extracellular matrix. Because it is a dominant trait, people who have inherited one affected FBN1 gene from either parent will have the Marfan syndrome. Marfan syndrome has a range of expressions from mild to severe. The most serious complications are defects of the heart valves and aorta. It also may affect the lungs, the eyes, the dural sac surrounding the spinal cord, the skeleton, and the hard palate. Here's some footage of a couple weeks ago of Jimmy having heart problems due to his Marfan syndrome. As you can see here, we have a normal person on the left and a person affected with Marfan syndrome on the right.
What is going on, Parker?
Yeah. Diagnostic criteria of Marfan syndrome were agreed upon internationally in 1996. A diagnosis of Marfan syndrome is based on family history and a combination of major and minor indicators of the disorder. Rare in the general population that occur in one individual. For example, 4 skeletal signs with 1 or more signs in the body system, such as the ocular and or cardiovascular system. Marfan syndrome is passed on to offspring dominantly. This means a child with one parent, a bearer of the gene, has a 50% probability of getting the syndrome. However, as the gene causing Marfan syndrome is known, arduous genetic techniques are able to circumvent this. Currently, there is no cure for Marfan syndrome, but the life expectancy has increased significantly over the past few decades, and clinical trials are underway for a promising new treatment.